So first of all, I want to explain what are the content and time schedule and also associate information. Everybody can see my laptop monitor, and here we can see the course calendar, right? Here we can see the date, and then we can see the classroom activities, and also we can see the related textbooks and assignment. I will explain everything one by one. First of all, you see the date here. Today is the 2/28/2022. It is the week 1. So how many weeks we will continue the pediatrics? Week up to week 8, right? Up to week 8. So the week 1, basically we will talk about intragumentary and or also hematology and oncology. So 3 chapters basically we will touch today. Intragumentary, hematology means blood, and oncology means cancer. So if you go in the textbooks, you can see the book name sender and chapter 33, 34, 35. Also page number is there, 403 to 429. So when you've done these 3 chapters PowerPoint, when you've done the read this chapter from the center book, we will do the practice question from Evolve. Practice question from Evolve, I said. What is Evolve? When students have the book, we call sender, this is the textbooks we follow. When you have these books, this book comes with the barcode or PIN number. By using that barcode or PIN number from the second page of this book, you can open the account online. This is called Evolved Question Bank. In Evolved Question Bank, we have 4,000 questions. We will practice every day. So I will explain more about Evolved Question Bank, right? But one by one. Week 2 means next Monday, we will talk about the metabolic, endocrine, gastrointestinal disorder, also quiz 2. So quiz 1 in the week 1, quiz 2 week 2, quiz 3 week 3. So where I will get this quiz? We will get this quiz from Google Classroom, right? So what is Google Classroom? Basically, when students get enrolled in our school, every student have an account, they have an email address, and they have Google Classroom. Google Classroom. So Google Classroom have every materials for you, what you looking for. And I am here, I will show you what is the Google Classroom, what is Evolve Question Bank, right? And also I will send you, or I will email the sender books, so you can open, you can learn. So this is the textbooks we follow. In this book, page number 7 or page number 2 or second page have a barcode. By using it, we can open the evolved question bank. And every student have a Evaluation Health Academy account. It is called email account. That is Gmail. By using it, we can use the Google Classroom. I will show all of them one by one. And next, here, week 3, we will talk about eye, ear, nose, and throat. Also, respiratory disorder. So respiratory disorder means the problem in our respiratory tract, upper respiratory tract and lower respiratory tract, means lungs. Upper respiratory tract involved or started our ear and nose and throat. So we will read it together. So it would be easy for us to read and to remember and easy to get. So now the same time, the sender book and chapter 38, 39, page number 457 to 478. And practice evolved question, you see. Same chapter, you have to practice from evolve. Week 4, the date is 03/21/2022. We'll talk cardiovascular, renal, genitourinary. And sender book chapter 40, 41. Same time, practice question from evolve. Then we have a midterm. I know 1,000 questions came in your mind. Like where I will get quiz 4, where will get midterm? Answer in the Google Classroom. I will show you the Google Classroom. Some of the students open the Google account or Google Classroom, but they do not have any content up there. It is empty. Don't get panic or it. We will put everything in time. So you have only monitor it. So week 5, date here. Then week 5 will talk neurological disorder. Sender book chapter 42, page number 499 to 510. Practice evolve question, same time. Week 6, we will talk musculoskeletal disorder, chapter 42, practice question. Week 7, infectious and communicable disease. Also, we'll talk medications, administrations, and dose calculations. And week 8, review. So this is the schedule, right? Or course calendar. Now let me go the syllabi. So pediatrics nursing, course syllabi or syllabus. So the course code is NUR 1005. And here credit hour is 3 credits, 45 clock hours. I'm going to email these materials today. If you like, you can read the course description. You read it by yourself. What are the course objectives? Promote the wellness of pediatrics patient. Pediatrics means child, right? Infant to adolescents and their family. Contrast normal anatomy and physiology with pathophysiology in each body system. So means anatomy means the structure of our body. Physiology means how body cell can work, right? The function of the body. And anatomy, structure, physiology, function. If any abnormality in the structure of our body or function of the cell, and disease processes start, and that is called pathophysiology. So like we will talk about the respiratory system. What are the anatomy of the respiratory system? Content of respiratory system. Nose, throat, lungs. How lungs work? Inspiration, expiration, oxygen, carbon dioxide exchanging. This is physiology. Like a patient develop the cancer in the lungs, cancer cell develop, or COPD. This is the pathophysiology with sign and symptom. Every system we will go very systemic way. Also distinguish sign symptoms of specific disorder. Identify diagnostic test and procedure for specific disorder. Differentiate between medical treatment for specific disorder. Describe nursing process for specific disorder. So here we say describe the nursing process, right? Because we are going to get RN license. The nursing process means there are 5 steps, right? Nursing analysis, nursing diagnosis, nursing planning or implementation, and evaluate. All together we call nursing process. Finally, integrate the provisions of holistic care. So you see the keyword is holistic, means a complete care, spirituality, psychological, mental, and physical demand as well. What are the clinical objectives? So when student will come last 2 weeks in our school, they will learn or get some skill, clinical skill knowledge. So at the completions of clinical rotation, the student will be able to demonstrate the professional standard of moral, ethicals, and legal conduct. So this is actually nursing ethics, right? Morality. So what is right, what is wrong? Demonstrate the professionalism, including attention of appearance, respect for self and others, attention to professional boundaries, provide nursing care to the family with children, perform basic nursing skill safely and effectively, administer the nursing care based on patients' families' present bio, social, cultural, and spiritual situation. So spirituality, cultural, social, psychology. So all is holistic together, right? Determine the patient's priorities of need. So prioritizations. So you are nurse, LPN or RN, whatever. So you have to know which patient need the care first. Prioritizations is important. Also, plan care accordingly. Complete nursing care for at least 2 pediatrics patients on time using an organized and efficient approach. Utilize the nursing process to administer care for pediatrics patients, family with clearly defined, commonly occurrence health care needs and problem, and also collect data on the patient's health status in a systematic and objective manner. So when we go through the system, particularly clinical rotation, we have to have the objectives, and this is our objectives. We will learn a systemic way, a standard way. We have to have skill to distinguish the priority of the patients. Then assess the data considering the normal physiological and psychological parameter. State of nursing diagnosis for each actual and potential problem. Deliver the compassionate, patient-centered, evidence-based. So, my friend, here I want to tell you, you see, evidence-based, patient-centered, compassionate, right? Health assessment. So every student must know this keyword. As I told you, evidence-based. If you do not know what it is, how you will answer, right? Like I have a 5 patient and both of them have a bad sore. So like I apply different kind of care for this 5 patients who have bad sore, and 5 patients respond in a different way. Which one is the best one, healing faster? We will follow in that one for whole hospital. So this is evidence-based care. What we do practice to prevent the infection, out of 10 hospital, which are the best? Just follow them. This is evidence-based care, right? Patient-centered care means what you are doing, it helps the patient to feel good. You meet the requirements what patient demand. If patient have a pain, you give pain medication. If patient need oxygen, you give them oxygen. If patient has a shortness of breath, you find out what are the cause of shortness of breath. Everything patient related, we call patient-centered care, right? So when we give the services, we will follow some ethics, autonomy, battery, right? We should follow federalities, provide appropriate patient teaching. So communication is important.